floaters are nothing but circles or black lines or dots that the patient sees suddenly in front of his eyes, while flashes are basically a bulb going on and off but inside the eye. So when a patient complains of flashes and floaters, we need to have a detailed look at the back part of the eye to make sure that a jelly inside the eye has not moved from its place. This could point towards a condition that is developing inside your eye, which is technically called as posterior vitreous detachment. Normally when we are born, there is a jelly that is attached to the back part of the eye. With age, what happens, this jelly starts separating. If this jelly separates by picking a piece of the back part of the eye, it can cause a major complication. So this happens because of aging. The jelly that is there inside the eye gets converted into water and the space that it occupies reduces. So it starts shrinking and separating from its original position. This separation is the cause for other complications that can further happen. It can happen to a younger person, but there are certain specific criteria when it does happen. For example, if somebody has a high minus power, or if somebody has an injury, or if somebody undergoes a surgery at a younger age, or if somebody develops an infection or swelling inside the eye, then it can happen at an earlier age. Generally speaking, a detailed eye evaluation is good enough to identify this condition, but there are certain scans and sonographies the doctor may take help of to confirm your diagnosis. Potentially dangerous, but 85 to 90% of the people, it's absolutely a normal aging process. It's only that 5 to 10% patients that need to be screened properly to make sure that the potentially devastating complications are not occurring. It can potentially lead to blindness if it is not caught early and if it is not treated early. Absolutely. So like I mentioned, 85 to 90% of the people, this is a normal aging process. So nothing needs to be done. But it's only that 5 to 10% people who are prone to developing retinal breaks is when the treatment is required. If we identify and catch this break at an early stage, it can be treated only as a retinal break. But if this goes unseen or not caught, then it can lead to a bigger retinal detachment, which subsequently will require surgery. If you suddenly see an increase in the number of floaters that you are seeing, or if you feel that the flashes of light that are there are suddenly increasing, or if you feel that your vision is dropping, are the danger signs that this condition is progressing beyond our control. Yes, usually if posterior vitreous detachment is occurring in one eye, within a year's time it can affect the other eye as well. That's why it's of paramount importance that you come to visit if the complaints of flashes and floaters develop in the other eye as well. There are no special precautions that you need to maintain, barring the fact that no strenuous exercise should be done and heavy weight lifting, say beyond 5 kg, should be avoided. After the laser treatment, you can resume your work immediately. It's just that we have put special drops in your eyes which will make your vision blurry for around 3 hours, but that should settle down in time. So the treatment for a retinal break is either laser therapy or ice therapy, or in later stages surgery. This could be related to a jelly inside the eye which is separated from its normal position, causing breaks to occur in this nervous layer of the eye. Once these breaks develop, there is chance that the fluid can enter the break and cause the nervous layer to separate from its normal position. So that is the reason he would have complained of blurring of vision.